Hi, my name is Andreas Seelich and I'm Director of Audiology at Hearing Solutions and the past president of the Canadian Academy of Audiology. After nearly 2 decades of clinical practice, I've noticed that many of my patients delay treatment. They do this for many reasons, because life gets busy, because they don't think it's bad enough yet, or that they can still just get by. Sometimes they feel they're too young, or that someone they knew had a bad experience, or maybe they're just not ready for some other reason. Unfortunately, what I hear from most of those same patients later down the road is that they wish they would have done something sooner. The research tells us that patients can wait as much as 10 years before dealing with their hearing loss, and it's my mission to change that. Most of those people were unaware that untreated hearing loss comes with a variety of risks. Lots of recent research has linked hearing difficulties with things like risk of falling, increased cognitive decline, and a whole laundry list of quality of life issues ranging from lost income to interpersonal relationship issues, quality of life, intimacy issues, and more. If things like cognitive decline and risk of isolation weren't bad enough, patients who delay treatment often have a much harder time adapting. As you can imagine, if you give your brain years to get used to hearing loss, naturally it's going to be much harder for it to get used to hearing those sounds that they once did. Doing so is a little bit like getting up in the night and turning on the bathroom light. It's a shock, it's bright, even though that same light during the daytime would be something that was far less shocking. The longer people wait, the harder it is for them to learn to adapt to those sounds again. And what's worse is that our brain thrives with stimulation. And without it, just like an unused muscle, it gets weaker and weaker. We even know that neighboring areas of the brain can take over regions of the brain that have been deprived for too long. We call this neuroplasticity. In your last appointment, you might have been recommended hearing aids. And if you were, I would urge you to consider doing something about it sooner rather than later. Remember, you have a 90-day trial period, and after 3 months, you can rest assured that you're going to know whether it's right for you and whether it's not. Even patients who end up returning their hearing aids often come back and tell us that, you know what, they were glad they did it. They don't have to sit at home wondering if it was the right thing for them to do. Those people are even a minority, roughly 1 in 20. If you're still on the fence, I'm at least going to give you a little bit of homework. As you go about your day-to-day life, look for some of the classic signs of hearing loss, like difficulty in noise in crowds, or trouble with accents, or missing soft speech such as when somebody's in another room. Another thing you might look out for is mishearing certain words, missing like a consonant sound. Like, did you say fat or did you say sat? So next time you miss the punchline to a joke or nod when you maybe should have shaken your head, consider coming back for your hearing aid consultation so that we can have you hearing at your best again.